Hi class, this is Dr. Lindner. I just wanted to show you the knee joint, some of the ligaments, and review some of the bones. Okay, so when we look here, this is the femur. Remember, you tell a small fib, so this is the fibula, which is the lateral bone, and then here's the tibia, the medial bone. This is from anterior. This is from the posterior view. So this would be the right knee. This is the right posterior femur, the right posterior tibia, and the right posterior fibula. And what you can see is that the osseous support for the knee is kind of poor. Like, we have these rounded condyles, right? And we have this tibial plateau that's flat. So when you have a rounded contour on a flat surface, it makes it unstable. So the innate intelligence creates a lot of soft tissue structures to try and stabilize that. So here's the patella, the kneecap, which we can see here. There's the patella. This is the quadriceps tendon, or the patellar tendon. And this is the infrapatellar tendon, aka patella ligament. Remember, tendons go muscle to bone. So all your quadriceps that are up here will come down and attach to the patella by the patellar tendon. But going from the patella to the tibial tubercle, bone to bone, that would be ligament. So that's the patellar ligament. Okay, so now on the outside is the lateral collateral ligament. On the inside, the medial collateral ligament. Sometimes the medial collateral ligament is called the tibial collateral because it attaches to the tibia. And the lateral collateral ligament is called the fibula collateral. And that prevents this valgus and varus stress, right? That prevents, this type of clipping injury from lateral to medial or medial to lateral. So it maintains the integrity. When we lower this, we can now see the meniscus, which would kind of be equivalent to like a disc, like an intervertebral disc. Think of it that way. It is fibrocartilage, pretty strong. There is a lateral meniscus and a medial meniscus, and we can see it from the posterior as well. Lateral meniscus, medial meniscus. If I bend the knee, we could take and see another look at it. It kind of looks like a crescent-shaped or moon-shaped disc. And it's designed to add to that concavity, to add to that contour of those femoral condyles, which are rounded. And then we have these cruciates. So if I lift this up, we have these cruciates, and the word cruciate means cross, like to crucify, a cross. So deep within the joint, if I open this up and separate that, we can see right there that little crisscross where we have an anterior cruciate and a posterior cruciate. Okay, they're named based on where they attach to on the tibia. So the anterior cruciate prevents anterior translation of the tibia. The posterior cruciate prevents posterior translation of the tibia in relationship to the femur. So if you were in a car sitting and there's an accident and the dashboard hits your tibia and drives the tibia posteriorly, you're going to damage the posterior cruciate ligament. And if someone tackles you and they're running and they tackle you from behind to the front and they drive the tibia forward, you're going to damage the anterior cruciate ligament. Okay. The menisci are usually damaged with a twisting type of force, where if your foot is planted on the floor and you stop and twist to change the rotation or the direction that you're traveling, that happens a lot in soccer or in tennis, then the menisci tear. Oftentimes there's something called a terrible triad, where you can damage the ACL, the medial meniscus, and the medial collateral ligament. Those three are called the terrible triad, often heard with a popping sound. Okay, very common in soccer injuries. Okay, so the medial collateral and lateral collateral prevent this valgus and varus stress, and then the cruciates prevent anterior and posterior translation of the tibia, and then the menisci, those are very important, especially with stairs, like walking down stairs, also with a twisting type of movement, a stop and twist to change the direction that you're running in sports. Okay, so that gives you a little bit of a good visual of the knee joint with the main cartilages and ligaments around the knee.